I am Dr. Zeina Chemali. I was born and raised and did my medical school back in Beirut, Lebanon. And I came to the United States in 1991-92 to start my residencies here. My work here at MGH as a main task was basically to start the neuropsychiatry clinics and the fellowships. So this is how why I came here and to do. And then, however, I've done global work throughout my life, being a native of Lebanon and being raised and did my education there. I actually lived through the civil war and so many wars, so that this is who I am today. It is my hope and my dream to be able to tell people in the Middle East and of people of Arabic descent, whatever, that actually there are other people that understand their struggles. I work in Lebanon. I work under the project is under the auspices of the Ministry of Social Affairs, the Syrian project desk. Within the Syrian project, the SMART program is the first time that it is given in Lebanon to start with. We took the SMART program, adapted it to a training that will be very much targeting the community in Lebanon, translated it into Arabic, so the whole SMART program is given to Arabic for the whole country of Lebanon, spanning 120 field workers. When you do medical peace work, you actually know exactly what you are facing as challenges, and you want to push that boundary using peace intervention, using health intervention as a way to get to better human beings. Because at the end, this is what you want. You want human beings to be better in their humanity, to be able to care for others. So that was the whole intervention. And this is what the SMART program teaches, is through the mindfulness work and through the relaxation response work, how to be better ourselves so we could be more empathic with others. And through that empathy, through that support, you build resilience. And so you build also stronger communities. Suddenly those field workers, feel that somebody cares. They always, it's impossible. We've never had that to us before. People just will throw us out on there and nobody really is mindful that much of our own well-being. And then you start hearing their stories. I had this a field worker. She had lost a family member, a very young brother, when she was herself very young as well. But how through the work, be able to get from her and the participants that she is probably the most person capable of understanding another person facing her that had somebody very close to them die. She was able to be more closer to that person that she had to take care of, rather than be a stranger and yet only be following that feeling that I'm helpless facing death. It's just, so that was very powerful. That was extremely powerful. So we're trying to also build resiliency, not only as the host community versus Syrian refugees, but try to find how the community of Syrian refugees itself can help each other. We were trying to work with what it is to be an elder, and also help younger generation, which are idle in camps or might be just on the streets. They are already fueled with a lot of anger and violence before they came, and then they're now with a lot of feeling of worthlessness and helplessness and very low self-esteem, just are waiting to explode anytime. So using really that elder council to work as peace catalyst. We're not going to see the change perhaps tomorrow, but I think there is this idea of planting a seed and making a change that will to be seen in just other generations to come. I want to say that the work is really at the start. Humanitarian aid is mostly, we go in there is a crisis, we try to help out. It's mostly kind of like a band-aid type of thing, and then we leave. Programs like the SMART program actually, if it can be incorporated in a humanitarian work, would be like really brilliant, because actually you see it. You see work in action. You see what can happen after the work is done. So my goal is basically to say it works, and we have demonstrated it works, and that will be also from our data that we are collecting and analyzing and publishing, and to tell, well, when you go do the Band-Aid, you need to do programs like that too.